Awesome. And I think we're all set. Do you have an address for that in case someone?
Yep, sure. Do you want me to put it in, where would you like that? I can put it in the chat. I can email it to you too.
Nope. Chat would be great.
Shoot, sorry. That was it playing back again. Say it again.
Okay. Chat would be great.
Okay, hold on 1 second here.
And I'm going to reclaim host while I'm at it. Okay, now.
Okay, there you go.
Awesome.
Okay.
Calorie view. I have a whole list of settings you need to change because Zoom won't let you change them and keep them the same way from webinar to webinar.
Like which things?
You have to always set screen share, which makes sense.
Okay.
You have to always change to gallery view instead of following host view.
Really? Okay. Yep.
Yep. And you can change you can change the chat too. So you can disable it if you so desire.
Is that stuff that you need to do ahead of time, or can you do it midstream?
And you need to do it every single time. You can't change those settings when you set the webinar up in the interface.
Okay. Did you need to make those changes before I started live streaming or no?
Nope, I'm done. I'll say you can change them on the fly. You just need
cool.
You just need to think to do it. Oh, Zoom is so quirky.
But thank you though. This is kind of a it's been a while actually since I've done these live streams. I know we used to do them with faculty at home. I'm not sure if they still do them. Johnny Melly has taken over that from when I used to do it more often, but I don't do them very often. So it's kind of nice to be reminded, and I appreciate you giving me that insight.
Well, I keep meaning to write down all the quirks into one seminar.
Yeah. If you ever do, I've been meaning to do stuff myself as far as like certain Zoom suggestions and things like that for people in general, like, instructors or students to use. And so, if you do happen to write them down before I get around to it, then shoot me an email if you can remember. That'd be great.
Oh yeah, sure. Yep. Thanks. I would love to. Okay. I am going to go live.
Okay.
Thank you much.
Okay.
Tim, can I try and share my screen?
Sure. Let me turn mine off.
Just real quick before we get running here.
Sure. Yep. You should be all set.
Good?
Yes, I do see it.
All right, perfect. I'm going to look for something else. Okay, so are you just seeing, if I advance these, you're just seeing my slide. You're not seeing anything else, right?
No, I'm just seeing your slide. You're in presentation mode.
Perfect. Okay, that works, Tim. I'll stop sharing now, and I know what I need to do. Thank you.
Perfect. Yep.
I'm going to step out for one.
Hey, Lori, just so you know, your
Hey,
microphone's on.
uh, and Tim, you're going to turn it over to me first, right?
You betcha, because you have to run soon, right?
Yeah, I do. Thanks. Okay. Tim, my video isn't started. I don't know if you want to do that.
Oh, yeah, that's a sad thing I need to change. Give me half a second.
Perfect.
Participant window. There, you can turn it off and on whenever you desire now. Zoom is all about setting its own options. We'll give this another minute or two until the participant count starts slowing down a little bit, and then we'll start. Okay, let's begin. Welcome to our February COVID update. On behalf of Staff Council, I'd like to thank you all for being here. Just some quick housekeeping things. As in the past, this is a web. So as an attendee, your microphone and your camera are off. We welcome questions in the Q&A box. If you are watching the live stream or watching on a phone, you can also send questions to staffcouncil@middlebury.edu. Staff council is all one word. We are also recording this and we'll post it on our blog in a day or so. And let's start off by welcoming Lori Patton, who popped in for a couple of minutes to say a few quick words.
Hi, everybody. I'm so glad that you've been able to join us this afternoon. And I want to just do a brief update before we turn it over to Mark and Jen that is based on what you now know is a familiar thing that we need to ask in any time of difficulty, but particularly in COVID, which is what are we seeing and what can you expect? Before I even do that, with a few quick points, I want to just thank you again, every single one of you, for the amazing work that you have done. I've been blown away by this community in little and big ways over the last year since we've been dealing with this really difficult moment and pandemic. And I am even more aware that we are working together at a time of COVID fatigue when your work at the college is particularly challenging, but in addition, you have outside stressors and ways of having to manage family and other obligations that are, and health obligations, which are particularly difficult. I want to acknowledge that deep stress, acknowledge that COVID fatigue, and say that your optimism and your spirit is inspiring to me in the midst of that as well. We're incredibly grateful for your partnership. Just to remind you, what are we seeing? Similar to the fall, about 2,000 students are returning to Middlebury in two groups on the 21st and the 22nd. after having a 2-week pre-arrival quarantine at home. This is essential. I sent out a video just to those students reminding them of how important this was. They're going to be reporting as before immediately to our field house, followed by room quarantine until they receive negative results. Then they'll move, as we did before, to campus. But the changes this term, campus quarantine, the changes this term, we're going to have not 2 arrival tests, but 3 arrival tests. And classes are going to be conducted remotely at least through the first week of the semester. We will not commence in-person learning until we know it is safe to do so. And we will continue regular testing for students in response to the latest conditions. And I know Mark and Jen will share more about that. With the increased incidence of COVID-19 worldwide and in Vermont, including the new, more transmissible strains, this semester could be more challenging than the fall. I wanted to be really clear that we need to prepare for a higher incidence of the virus on campus. And that is something that we need your leadership and help making sure folks are aware of. We have a new close contacts rule for our students that is more stringent than we had in the fall based on the Vermont guidelines. This means that students can have up to 6 close contacts with whom they can gather casually, but they still must follow all the room capacity guidelines, and roommates are automatically close contacts. They can also gather with others that are not their close contacts according to all the health and safety protocols. We also want to remind everybody that the best way to prevent the spread of the virus is strict adherence to core health and safety protocols. Study after study and the scientific literature shows this. And we also wanted to let you know that we are simplifying in our approach and response. And that is, we are not going to have phases, but a slow easing of restrictions over time that will be published. And we are going to be sharing those approaches, and you can just check on those in our reporting dashboard literally every day. And we are also going to be having weekly webinars for all students to remind them of what is possible and what isn't. We've also updated our conduct policies and will continue to publish statistics about cases as well as disciplinary cases. We're going to be continuing to monitor those local health and regional health conditions, and to remind everyone that if those conditions on campus or community change, we are prepared to shift to room quarantine or send students home. And we are going to continue to rely and communicate with you regularly on the guidance from the Department of Health and the Porter Medical Center partners. So far, with the exception of the Norwich outbreak, all of the incidents so far remain at a low percentage in our partner schools, and the testing has shown that students are arriving with a fairly low percentage. So we are pleased to see that. I also wanted to end by talking about the mental health of our students and how important that is. We are going to continue to drive engagement in telehealth so that students kind of have access to the care they need, and to continue to refine access to our counseling center where people can get an immediate short-term appointment and then assess their need over the long term. Our focus is really on keeping our clinical health services running and tending to positive cases if we have them, and offering support to students in the broader community as well. And another key element is that we are going to expand our outdoor activities because our students did such a remarkable job in following healthy safety protocols in the fall, leading to the low incidence that we have. We are excited about providing many more outdoor opportunities for students, including artistic outdoor opportunities, an outdoor ice rink, skiing and snowshoeing on the Ralph Meyer Golf Course. You're going to be noticing some new tents and fire pits and hot chocolate huts as you drive through campus or come through campus if you are coming. And we are really trying to embrace the cold weather and what we can do in Vermont to live out in that space. And as conditions improve, we hope to allow students to travel into town, including also in Addison County, the Snow Bowl and Reichert Nordic Center. We learned a lot from the fall. We've made some changes, and we were reminded again of this community's incredible fortitude and resilience and perseverance. And I want to thank you again for everything that you're doing and have done and will do on behalf of Middlebury. And with that, I'll turn it over to Mark and Jen. Thank you very much. Take care, everybody.
Thanks so much, Lori. I'm going to start sharing my screen, which you should see momentarily. Great. That was a great summary of where we're headed this semester. I'd like to give you a bit of a situational update because the national, regional, and Vermont, and even our local situation really flavors what we do. So, trying to advance my slides here. Sorry about that. That's not working. There we go. Went too far. Okay. So nationally, this is the national trend, and the red line is the 7-day average, and you can see that it peaked in December, and it's that slope way over on the right is going down. In the last week, we've seen a 22% reduction in cases nationally. That's really good news. But if you look at where October is, or in September, this is where we were when we were bringing students in. This was that summer surge, and look where we are today. We're certainly higher than that on the national scale. So still a bit concerning, but the trend is favorable. Hospitalizations tend to follow that trend, and there's been a 14% reduction in hospitalizations nationwide over the last week, but they've gone down 45% since early January, which is good news. Deaths tend to follow the hospitalization and case rates a little bit more slowly, and so we haven't seen as much of a drop. There's only been a 1.4% reduction in deaths, but we hope that that continues to follow the trend and be reduced. The vaccinations nationally are increasing, and that's as supply becomes available. When I think about vaccines, it's space, staff, and supply. We've got the space, the Department of Health has the staff. It's really supply that's been the issue and forced adoption of some age-related groups, which I'll get to in a little bit. But I'd say right now, there's 46 million people in the United States that have been vaccinated, or at least received at least one dose. Thinking about our New England region, we can see that the cases here are also going down, and we're not where we were back in August and September in our region. We are way up here, kind of where we were at the peak of cases back in April. So again, we're making progress. That slope is coming down, 57% decrease since early January, but we've got a ways to go. In terms of positivity rate, this is really good news. The percentage of people actually testing positive is dropping. That could be a denominator factor as testing tends to increase as colleges start ramping up testing. But still, the trend is favorable. And this is in the New England region. So in terms of our cases, this heading is incorrect. I apologize for that. In terms of our cases, you can see that in Vermont, our trend downward is a little bit slower. You can see back here in December to early January, there was a 105% increase in cases, and this is the 7-day average, this line per week. And then it's slowly trending down. Is a 34% drop between that point and this point, but we, again, still have a ways to go. At the county level, Addison County is doing well compared to some surrounding counties, and so good job, everybody. We're not quite sure why. You can see here, you can see up here, 5 cases per day, and that's about where we are. The new average is around 4.6 cases per day, and that's been slowly dropping down, slowly decreasing, which again is reassuring. But some of the other counties are staying fairly high, and that's causing the Vermont case rates to be elevated, and it's really demonstrated on this slide. As you can see up here, Bennington County is really having a lot of cases per capita, per million. These are active cases per million. Franklin County's having some, Rutland's having some, Essex is having some, but they don't have many people that live there. So their per capita rate is high, but the total number of cases isn't very high. But look at all other Vermont counties here, you can see that we're doing pretty well. However, the travel map thresholds that we were looking at back in the summer are way down here at the bottom, and we were in the green at one point, and we've got a ways to go. When it comes to colleges, what are we seeing in colleges in Vermont? As Laura mentioned, cases are up. So if we look at this chart, you can see here in the blue, these are cases, these are Vermont weekly cases, and at the very top, I don't know if that's red or green, but these are the top little bar there. These are the cases we're seeing in colleges. These are coming out of colleges. And yeah, some schools have had a lot of cases on arrival. Certainly Norwich did. UVM and Castleton had a few, but there are other schools like Union, Tufts, and Colby that have seen a lot of arrival cases. Now, they tended to have arrivals occur closer to January 1st. And so I think are delaying the arrival until late February was a good move in retrospect. Bowdoin just onboarded 1,000 students and had 2 positives. Williams, more, I don't have the exact number, they're around 1,500 to 2,000, and they have around 10 cases. So it's a mixed bag. Some schools are having a lot, some schools aren't having as many. So as Lori pointed out, we're watching it closely. This is where we are today, or where we were yesterday in terms of our testing. We have no active cases on campus, either student or employee cases. We did have 4 employees test positive off campus at the Department of Health Testing Center. We did have 1 go through our test center and test positive. And the good news is when we did contact tracing, there were no other close exposures, and our exposure control plans that we work so carefully on are actually working and preventing lots of other people from needing to quarantine or isolate. So that's the sort of situational update. I kind of want to, we'll go into some art history here. I don't know if anyone can name this artist. If you can, maybe you can throw it in the chat. But this is how I thought of COVID in the fall. So it's sort of segmented. You can put things in different boxes. You know, maybe we have arrival testing here, quarantine and isolation here. This might be targeted testing. Here's how we're doing dining. And that was in the fall. And now, 6 months later, or maybe longer, 9 months later, this is how I think of COVID. Name this artist too, if you can, in the chat. There is a pattern there, but it's a little messier. And there's a lot more to think about right now as we head into the semester. The first thing is a vaccine discordant or infection discordant campus. What I mean by that is we have individuals that have had COVID or that have even received vaccine. We have some students that are healthcare workers or EMTs when they're not students, and they've actually received vaccine. And we have to be able to manage them and help them with what they need to do. I think there's pictures worth 1,000 words, right? We can see different levels of mask compliance that I think is interesting. I don't know if these are small family groups or not. I know nothing about this picture other than this person's carrying a mask. This person's wearing their mask while they're eating. No mask here. I think the guy that says winning is all he knows is wearing a mask, which I think is great. But as you can see, there's different levels of mask use, and that's one of the reasons for some of this surge. And when we think about the discordant campus, do people that have had infections in the past or had vaccine in the past wear a mask? Do they have to distance? Do they get sort of what's called an immunity passport? And what we know from the CDC and from the Department of Health is that they don't. So this is important. For universal precautions apply to everybody, whether they've had prior infection or had a vaccine. So they need to wear a mask, stay distance, avoid crowds, avoid poorly ventilated spaces, wash your hands often, follow CDC guidance. And this is important, follow any applicable workplace or school guidance. So they're in our ballpark still. There's a couple exceptions, which I'm going to note. The first is when you're looking at people that have had a COVID infection in the past. This is brand new, I think last week. The CDC says they no longer need to do any repeat testing or quarantine if they meet certain criteria. If they've fully recovered from their illness, if it's in the first 90 days from the onset of symptoms or from their positive test, and if they remain asymptomatic, if they are exposed to someone that through contact tracing we determine that they were exposed, they do not need repeat testing and they do not need to quarantine in that 90-day window. However, Department of Health says that they do need to quarantine for travel and they're still not allowed to gather. And these are the rules that are in place today. And that's for people that have had COVID infection already. So we are not testing, I'd say around 40 students are in that 90-day window. They're arriving, they've had COVID within the 90 days, they feel fine. They're doing their pre-arrival quarantine anyway because we don't want them to bring flu or other viruses to campus. And they are not going to have to test when they arrive. When their 90-day window's up, they'll fall back into our testing pool unless the CDC or Department of Health extends that beyond 90 days. So let's talk about people that have received vaccines. Very similar guidance. Vaccinated individuals that are exposed and identified through contact tracing as an exposure are not required to quarantine if they've received a full vaccine dose. Right now, that's 2 doses of the Moderna or 2 doses of the Pfizer, and it's been 2 weeks since their last dose, and they're within 90 days of their last dose, and they're asymptomatic. But they still need to do testing if we're going to test, and they have to follow Vermont travel guidance and not gather, according to the Department of Health guidance. As you can see, it's a little messy. Other things that have gotten a little bit more complex are testing results. And I just want to alert people, we'll guide people through this if it applies to them. But when we do a test with the Broad Institute, who's our lab that we use for our tests, there's several different categories. There's negative and positive, that's self-explanatory. But you'll see here, there's invalid tests, and then I'm going to skip down a couple to TNP or unsatisfactory tests. Those I lump into insufficient sample, okay? An invalid test means that the testing device was unable to identify any human DNA or nucleic acid material. It may have found viral, but it couldn't find human, so they don't count that as invalid, and that doesn't lead to positive tests down the road. We're fairly confident on that. We're definitely confident on that, not fairly confident. We're definitely confident on that. And well, all we do is retest. The same here for the unsatisfactory. Maybe there was too much mucus on the sample. Maybe the swab was inserted upside down, although I don't think so at Middlebury. But there were lots of codes for the label wasn't on right, or it got smudged, or the tube broke in transit. So those fall into the insufficient sample because these are asymptomatic tests that we're doing that I'm talking about. The new category is this bolded category, inconclusive. And this is a new category from the lab because they changed the way they do the test. They now have 2 viral probes that they use. And for the test to be positive, it has to find human material and then viral material on both probes. What they've found is when there's viral material on only one probe, it doesn't mean that there's infection. However, when they've done subsequent testing soon thereafter, a fair number of those people test positive. So what they're saying now is that is an inconclusive test where one of the 2 viral probes is positive and there's human material on the swab. Is that an indication of an early positive test? We're not sure. So what we're going to do is we're going to, when we get that result, is I will be reaching out to the individual, the employee or the student, and asking them to isolate themselves at home, and we have guidance we can share with them about how to do that effectively. We're not saying it's a positive test, but they do need to be retested. And so we'll have guidance for that we can share with them. HR will work with those individuals on, it's essentially the same as if we were asking them to quarantine until we can get another test. If that subsequent test is negative, then they go back to daily life, and human resources ready to help individuals. We hope that there aren't many of these inconclusive results. I just want to alert people that this is something new. Variants. There's a lot of concern about variants. There are 3 main variants of concern currently in the United States. The UK variant, there's around 1,200 cases in the US in 37 states. The concern here is that these new variants may have more efficient or rapid transmission. And there's one report out of the UK that may be associated with an increased risk of death. However, we're not sure if that was just purely a volume phenomenon or if in fact the virus itself led to more death. The CDC is currently saying that there's no evidence to suggest that this variant has any impact on severity of disease or vaccine efficacy at this point, but it's early and studies are ongoing. The South African variant was found in October, and the CDC again is saying that there's no evidence to suggest that this variant has impact on disease severity. However, there may be an impact on the ability of antibodies to work effectively, either from prior infections or if we're using, say, monoclonal antibodies in a treatment. There's only 19 cases right now in 5 states, although as you'll see in a second, Massachusetts reported their first case. The last one is the P1 or Brazil strain. There's only 3 cases in the United States. This one is more concerning because of the ability of it to get by our defense. If you've already had COVID infection or vaccine, this one may be able to allow reinfection. And so this is being watched carefully. So what are we doing about that? The Department of Health has been testing and checking for this, and they recently, I think in last week, found the UK variant in some wastewater in Burlington, but the Health Commissioner, Mark Levine, told us on our Tuesday meeting that they haven't found any direct evidence on a swab from anyone yet. And as I just mentioned, in Massachusetts last night, they announced the South African strain arrived in Massachusetts. So how do we detect these things? We do something called whole genome sequencing. And there are very specific criteria for how we do this. We'd look for samples where someone had been vaccinated and then got infected again. That might be a vaccine breakthrough. Or someone that had another case within 180 days. Or if we saw a really high attack rate. So, for example, Norwich had a pretty high attack rate. They tested, and so far, none of their samples have come back with any of the new variants, which is interesting. We would also look for situations with efficient transmission. If there were cases that were showing up where maybe it was less than 15 minutes of exposure, and there was an outbreak associated with that. Unusual clinical presentations, people getting really, really sick really fast. Or as you see here, geographic clustering. Is it a certain case that's showing up? There's a high, Middlebury has an outbreak, but the surrounding area doesn't. Is something going on our campus with a variant? And then you can see here wastewater, they've been checking for those. So if they find it in wastewater, they're gonna start checking more samples in the local region. What we need to know is that this requires a separate test, that Middlebury and the Department of Health are operationalizing how we're gonna do this, and that what the health experts say is in order to prevent these variants from having a dramatic impact, our mitigation efforts really, really matter. And that's the masks, distancing, and those things. Let's talk briefly about vaccines. There are 2 vaccines available. They've been shown to be highly efficacious in preventing severe COVID-19 and hospitalizations, which is great news. So if you have the vaccine, you might still get it. You might still get COVID, but you're less likely to end up in the hospital or die from it, which is great news. We're not really sure about reducing transmission and how long the protection lasts, or the impact of the variants and how effective these vaccines will be against them. But the recommendations are, if you are eligible to receive a vaccine, it's highly recommended. I have received mine and feel that I've looked at these vaccines in terms of safety, and I believe they're very safe and based on the technology that they're using, for whatever that's worth. I think if you have a medical condition or you're concerned about your health, I think talking with your healthcare provider about whether or not you should get the vaccine is your next best move. What I've shown here on the slide is the different phases that Vermont is using, because the allocation from the federal government, as many of you know, is not as high as we'd like. So they're targeting first long-term care residents and healthcare workers and first responders, but then they're going into who might be at highest risk of death. And those tend to be our older individuals. So they're started with 75 plus, 70 plus. That opened up this week. And then in early March, they're hoping to go down to 65 and up, and then people with high risk conditions. And there's a very defined list that's of conditions that apply. People on our campus right now can register with the Department of Health to get a vaccine. This is right off their website. They advise people to get a step ahead and create your account with them. And then when they release your age group, you can go ahead and sign up online. If you have done Department of Health testing in the past, you need to use the exact same account information for signing up for a vaccine. They're very clear about that. And then I've got a picture of what that screen looks like. It's pretty easy. The COVID-19 vaccine website on the Department of Health has lots of good information. You'll see here there's a telephone number you can call if you're having trouble with the computer. But they really do encourage people to register online. And they're the call center hours. You can sign up for the weekly COVID-19 update. If you don't want to think about checking or following the news, you can sign up for that update and they'll send it to you and you can know when your age group or cohort is has vaccine available. I just want to point out that we have that vaccine, there's a bit of potentially a bias on who gets vaccine, and that people that might be eligible for vaccine but may not have access to a computer or have difficulty with computer or even navigating these registration processes may not be getting the vaccine when they could. And I just encourage people to think about folks that they know in their lives that might benefit from some help and maybe offer helping to sign someone up to get the vaccine. It's pretty easy to do on the Department of Health website. Okay, I just want to touch on a few studies that have been very helpful recently. These are hot off the presses. This came from the CDC. There was a Wisconsin school district that opened up 17 schools, K through 12, and what they found was if they did standard mitigation measures and they had 13 weeks of in-person learning, they didn't have any spread that occurred from staff, to or from staff in school, despite times of high community spread. Basically, the schools were actually a safe island, and they were doing in-person teaching with mitigation measures, and they had lower rates of infection than the surrounding communities. Now, this was probably pre-variant, so we're not quite sure the impact of that, but no one really knows for sure. But certainly encouraging news with respect to in-classroom transmission in the K through 12 and how we might apply that to the college setting is in question, but it's encouraging news. The next study I want to show is just what happened on a college campus last fall at a large university in South Bend, Indiana. And they came in, they had some pre-arrival, they had some early cases on people that came to class before classes began and then right after class began, but then they had a large outbreak and they instituted measures, including 2 weeks of fully remote instruction, but they instituted measures that dramatically curtailed the outbreak and they were able to continue in-person learning. And what I can share with you is, if reading this paper, is we are already doing all of the measures that they instituted to control their outbreak. We're already doing it. So I think that's good news. Finally, last week, made big news about, this is the double masking study. And if you read the paper, it's really more about making sure your mask fits well and less about whether or not you're wearing one or two masks. And Jen Kazmazak is going to go over that in a lot more detail. But this could be potentially a game changer, that if people are wearing masks that fit properly, they can reduce transmission up to 95% when both people are doing that. So really, really good news. And Jen will go into details about how to do that. I'll just finish with, I've discussed a lot of changes, but some things haven't changed, and that's the mitigation measures. It's really distancing, proper fitting masks and using masks, and not gathering or having crowds. Those are our best tools today while we wait for this vaccine deployment to kick in. At this point, I'll turn it over to Jen Kazmazak. Thanks, Jen.
Great. Thanks, Mark. And thanks to everybody for joining us today. I also wanted to quickly thank Staff Council for supporting us and setting this up. It made it really easy. Mark and I just literally needed to show up, and we're really happy to be able to share some new information with you. I'm going to share some refresher information, but it's amazing in listening to Mark talk how much is new. You know, I feel like we spent most of 2020 sort of going in a more restrictive direction, and now it's exciting to see the science catching up and to be spending so much time talking about vaccines. So that's great. So as a transition from the information Mark shared, I really want to start with a lot of details actually about the face mask guidance from the CDC. Next slide, Mark. So what you're going to see show up on this next slide is a visual from the MMWR report, and that's the study that Mark just mentioned. I like this figure from the report because it gives a good visual of what type of masking was used in the experiments. So what you can see quickly on the left, this was just a standard medical mask, which many people wear. What we find, and I'll talk about this later on, is depending on the size and shape of a person's face, it really depends what kind of fit you're going to get. And with those kinds of masks, you will see gaps between the masks and the sides of the face. The experiment looked at a couple of simple ways to improve the mask fit. So one is the double masking, where they took a simple cloth face covering, put it over the medical mask. And then the photo you see all the way to the right, this is what they call a knot and tuck method. So it's basically putting that same mask on, but doing it slightly different so that it gives you a really good fit. And as Mark mentioned, those lab tests showed that exposure to potentially infectious aerosols decreased by about 95% when both I guess of the dummies and the labs were wearing tightly fitted masks. So the implication for public health from these experiments is that it quantified the importance of a good fit. So it's a lot of common sense that we knew, but we have the science behind it now. And although this experiment used these specific masking types, there are multiple simple ways that we can achieve better fit of masks. Next slide, please. So the CDC's guidance that was released late last week is excellent, and I really encourage you to go to the CDC site and read all of the details. I'm going to just cover some basics out of it. What they are giving guidance on is ways to improve the fit and filtration of your face covering. So how well a mask fits, how well it filters the air, how many layers it has, all are important considerations when you choose which mask to wear. If you're wearing a cloth face covering alone, you want to select one that has multiple layers of tightly woven breathable fabric. You want to make sure an easy way is hold your cloth mask up to light and make sure that you can't see light coming through the fabric. You want to use one whenever possible, something that has a nose wire, and this helps prevent air leakage at the top of the mask. Nose wires also can help people who wear eyeglasses. I know it's a huge challenge to find something that works and that prevents fogging. So to get a good fit, you can bend that nose wire over your nose to conform to your face. And then another strategy, which is what they used in the experiment, is this double masking, which means you combine two masks. So this can both improve the fit by pressing that inner mask closer to your face, reducing the amount of air that leaks around the edge, but also improves filtration simply because you're adding more layers of material to reduce the number of droplets that can come through the masks. So one way to do this is to take a 3-layer disposable medical mask and put that underneath a simple cloth face covering. I want to mention there are some mask combinations that should not be used to double mask. So the CDC does not recommend that you take 2 disposable medical masks, because these are not designed to fit tightly, and wearing a second disposable mask doesn't help improve the fit. And then I'll talk about KN95s in just a moment, but you do not want to combine a KN95 mask with any other face covering. Now, the knot and tuck method, which you saw in the photo, that is another way to improve fit and filtration. So there's a couple simple ways you can do this. You want to make sure if you take a medical or a disposable mask that it is indeed a 3-layer or 3-ply medical mask with a nose wire. So there's lots of masks out there, and that's what you're looking for. 3-ply medical mask with a nose wire. This knot and tuck method is simple. You basically knot the ear loops at the sides where they join the edge of the mask, and then you fold and tuck the unneeded material underneath before you put it on. It's interesting. The first time you do it, it feels a little bit awkward, but you get the hang of it very quickly. The CDC provided a link to a 2-minute video, and it's from the Director of Infection Prevention at UNC Hospitals. And she shows the simple steps of how to get a tighter fit from an ear loop mask. So I'll talk about our Safe Colleges training in a moment, but that video is at the CDC page, but it's also part of the employee COVID training. So you'll be able to watch that helpful video when you complete the training. Next slide, Mark. So there are many types of face coverings you can use to protect yourself and to get the right fit and filtration. So people ask, which face covering should you choose? There is not a one-size-fits-all when it comes to face coverings. Every person has a different size, different shaped face. Everyone has a different preference as to what is most comfortable. So the most important consideration is that you select a face covering that fits properly. So you need it to completely cover the nose and mouth, fit, and it needs to fit securely and snugly. So I've just talked about the cloth face coverings and things that you should look for. I also want to mention that you should not wear any cloth masks. They sometimes make masks that have exhalation valves or vents. You don't want to wear anything like that. And you don't want to wear just a single layer or anything with really thin fabric that does not block light. So disposable masks early in the pandemic, and certainly when we started wearing face coverings on campus last spring, medical face masks were in short supply. However, these disposable 3-layer medical masks are now widely available. And using that knot and tuck method is an easy, simple way to get a good fit and to get good filtration. Now let's talk about KN95s. We've definitely gotten a lot of questions about that. I know a couple were pre-submitted, so hopefully I will be able to answer those in the next couple of minutes. What KN95s are a filtering face piece respirator. So they're commonly made in China. They are very similar to the N95 masks that are commonly used in the US. If you choose to wear a KN95 mask, there are a few important things that you need to know about. You don't ever want to combine a KN95 mask with other masks. You would only wear a KN95 alone. If you have certain types of facial hair, a KN95 may not be the best choice because it does rely on sort of a fit similar to an N95. And sizing is important. So you don't want to just, put one on and assume it's going to protect you. It has to sit on your face properly. Not everybody can properly fit or tolerate a KN95 mask. So that's why the CDC is giving all of these different simple options for improving fit and filtration. They also make these things, I've never used one myself, but a mask fitter or a brace that you can put over a medical procedure mask, or as they mentioned, the double masking with a cloth mask over a medical mask is adequate. One final caution I'll give you about KN95 masks. The CDC has, and you'll see it on their website if you go look at the mask information, they are finding that about 60% of KN95 masks in the US are counterfeit right now and do not actually meet NIOSH requirements, which are the US standards for a filtering face piece. So if you are looking for a KN95 mask, I encourage you to go to the CDC page. They have links to detailed information about this issue that I think you'll find helpful. And then finally, I'll just mention N95 respirators. These are also called N95 masks, particulate respirators, or dust masks. If those are fitted properly, so there's a procedure that you go through to be fitted for this, these masks provide the highest level of protection from large respiratory droplets and small airborne particles. These are still in short supply and should be reserved for healthcare workers and first responders. Next slide, Mark. So now I just want to remind you about the risk pyramid. I know we talked a lot about this throughout the year last year. This is used to assess exposure to COVID-19. The goal is to assess the exposure and apply control measures to reduce the risk. So what I want to do is go through the pyramid quickly and specifically talk about face coverings for each level of risk on the pyramid so that you can see how this might apply in the workplace. Mark, next slide, please. So a low risk exposure is when tasks can be performed while avoiding close contact with others and in appropriate environments. So this would be outdoors or indoors in well-ventilated spaces with physical distancing. If you are in a low risk situation, you want to have a well-fitting face covering and physical distancing. This is a good chance for me to remind you on campus that face coverings have to be worn by faculty, staff, and students in indoor and outdoor locations with few exceptions. So for employees, the exceptions are when you're in a private space, if you are eating and you want to make sure that you are appropriately physically distanced from others, and you always want to have a face covering with you. Even if you're in a private space, if somebody enters, you want to be able to put it on right away. Next slide, please. Okay, so now we want to get into medium risk tasks. So we talk a lot about this. Departments go through exposure control planning, and medium risk tasks are those when you have to be within 6 feet of someone for more than 15 minutes. Or if you have direct physical contact with somebody. So when we look at a hazard assessment, we think about what activities require that. We always want to look at other controls that can be used, so such as putting a plastic barrier up as an engineering control. However, there are tasks that do require close contact. So options for improving mask fit and filtration should be used. So as we talked about, double masking, knot and tuck, using one of the other techniques that CDC recommends, that will be important when you're in a medium risk situation. Next slide. And then just to sort of finish off the pyramid, you can see that very high risk and high risk exposures are healthcare workers that are performing or present for aerosol generating procedures and support staff who might be in close contact. And so we do have N95s, we have powered air purifying respirators, and those employees who are involved in those tasks are trained and provided with PPE. Next slide, please. So just a reminder, I won't go through the details of this slide, but I think you all remember our hierarchy of controls. This looks at types of hazard controls by effectiveness. So we still look at using engineering controls first, and that basically isolates people from the hazard. Ventilation, barriers are a couple of examples. Administrative controls really change the way we work. So staggering work schedules, alternating days employees are on campus, adjusting capacities for physical distancing. You see that PPE is at the bottom of the hierarchy, and that's always the last option if we can't use other control measures. What you don't see show up, and I know we talked about this last year when we first rolled out this information, is that what does not show up on the hierarchy of controls is the use of face coverings. So a way to think about face coverings is they're not PPE, but you want to think of them as community protective equipment. Correct and consistent use of a face covering is one of the most critical steps that we can use to protect the spread of COVID-19. CDC calls this universal masking. So widespread use of face coverings is a proven public health measure. It's source control, and that's the way we want to think about it. So when you're selecting and putting on a well-fitting face covering, think about the importance and the impact to our community. Next slide. So I often cover the risk pyramid and that hierarchy of controls, but lately I find myself talking more about the Swiss cheese model. And I really think this gives a better visual of the multi-layered approach that we've been using at Middlebury. So you want to think about every layer of protection that we have against the virus as a slice of Swiss cheese. On its own, every layer is prone to weaknesses or holes. No layer is perfect. But added together, the holes get covered up by the stacked layers. And even if one layer fails, stacking the other strategies will prevent transmission. You're familiar with the layers we use. They're all important: daily health checks, face coverings, distancing, hand washing, and then all of the visitor and travel restrictions, ventilation, so many things that we have in place to prevent transmission. Next slide, please. So I want to just cover a couple quick reminders about what to do to prepare for working safely on campus. So Safe Colleges shown in the upper left, there are 2 things in Safe Colleges for you to do. Even if you were working on campus in the fall, you should go onto Safe Colleges. You're going to read and sign off on the updated employee health pledge, and you're going to take COVID-19 safety training refresher. And that just takes about 30 minutes. There was a question, thank you, Julie, in the Q&A. When the email went out with links about Safe Colleges, it was pointing to the student Safe Colleges portal. So I apologize for that. If anybody has tried and gotten an error, you can simply use a Go shortcut, Go Safe Colleges, and that will get you to the employee training, and the students have their own portal. So you need to enter into the right one. Departments are busy updating exposure control plans. Those that are already working on campus are going to refresh and really think about this face covering and really talking to your employees about what they should be using to have a well-fitting face covering. Lastly, I want to encourage you to read the Spring 2021 Campus Guide that's available on our webpage. Next slide, Mark. And this guide is easy to find. If you go to the Middlebury homepage, there is a link at the top that says essential information. And if you click there, you will get to the Spring 2021 page. There are 4 main sections that you'll see, all very important and informative. Sections 1 and 2 talk about essential health and safety measures and preparing our campus. That's applicable to the entire community. Section 3, living and learning on campus, is really geared toward our students. There's a lot of information in there, but many topics will be of interest to faculty and staff. And then section 4, working on campus, is focused on employees and provides details about departmental planning and how to create a safe workplace. Next slide, please. So the last thing I would really like to mention about the webpage is that we are drawing on lessons learned from the fall. Lori made some comments in her intro, which was great. What we are doing, instead of progressing through phases with rules and restrictions for specific time periods, this campus status webpage you can find off of our dashboard and right on the main webpage, Spring 2021. That will list activities that are permitted on campus each week, required behaviors, alert status, travel restrictions. If campus health conditions allow, we'll move more quickly to incorporate lower risk activities, such as those that are held outdoors or indoors in approved spaces with the core health precautions of face coverings and physical distancing. Next slide, please. And then finally, I just want to touch briefly on the approach to how we'll manage COVID operations this spring. I think it's been mentioned that we should be prepared that we will have more cases on campus than we did in the fall. We have really entered a sustained phase for COVID-19. There is a small focus team that's meeting daily to review the regional, local, and campus health conditions and manage the day-to-day work associated with COVID operations. So testing, responding to positive cases, whether it's employees or students, and supporting students who might need to move to isolation or quarantine. While that team meets daily, I do want to just mention this is truly an entire campus effort to operate during a pandemic. So I won't go through all the details of every box on the slide, but I think it's good to see a big picture of all the structures that are in place to support our students, our employees, and campus operations. And we are ready to modify as needed based on local and campus health conditions. Next slide. So just to close, I think you've heard this a lot today, and you're going to continue to hear this throughout the spring semester. At a time when we are all experiencing pandemic fatigue, it's more important than ever to protect ourselves and one another. And it is these core health behaviors that work. So all of us, including those who have been vaccinated or those who have recovered from COVID-19, we do need to remain extra vigilant and be patient and persistent as we move into the spring semester. So thanks to all of you for working safely. Everything that you're doing absolutely has an impact to protect yourself, but to also protect our campus.
Thanks, Jen. That was great. We have a few minutes for questions, and it looks like some of them have been. I'll take the first one. Are we going to vaccinate staff working at the test center? I wish we could. Vaccinations are all controlled through the state right now. The allocation is going to them. We are in communication with the Department of Health and Porter and UVM Health Network about how we might help with the vaccine effort. But right now it's directed primarily at those age groups that I mentioned.
Mark, maybe I'll jump in because I know there was one that was submitted about walking socially distant with students, and then I think someone else asked about having lunch either on or off campus. Great question. I guess what I'll say is the arrival phase is going to be our most important period. So we're going to have a lot of restrictions in place for everybody, students and things that we can do on campus. Once we open up to in-person classes, that would indicate that the campus health conditions would allow for that. We will allow low risk activities. So think about anything where you can have face coverings and be distant. Outdoors is great. So somebody mentioned, can I go for a walk? That would definitely be something that's allowed. The face coverings off, eating and drinking is definitely one of the areas that we all need to be concerned about. So I'm not going to say no, that you won't ever be able to have lunch with a student, but I think that we're going to take a little bit more time to get there. But, you know, certainly when I get asked questions, I always say, if you can have a face covering on and stay 6 feet apart, the answer is usually yes. And outdoor spaces are great.
There were questions about us providing masks to employees who are working campus in place with numerous people. So this mask guidance is literally hot off the presses, and we went and purchased. The first thing we did was we went and bought enough surgical masks to give each student a box of 50 in their welcome kit. So students should have masks that will fit well, and they can do the loop and tuck, or they can put their cloth face covering over it to meet the new guidance. We are purchasing more masks, and we'll have them available. How we operationalize deployment of those masks, we're still working on. As I said, this is just brand new guidance. I think it's exciting, and we will have masks available. There does not appear to be a shortage of these masks, and we're purchasing the highest grade disposable mask we can get our hands on that would be work in an operating room. So we will have those available. I would encourage, however, people to think about what they're doing, when they're not working, and to still think about masking appropriately and getting masks that fit this new guidance. There's plenty out there. In fact, someone put a suggestion in the chat. If you're not sure if the mask is a good one or not, just look at the CDC website on masks, and it will tell you exactly what you need to know in terms of the fit and so forth. Can staff have lunch either on or off campus with a student? Jen, you want to take that one? You want me to do it?
Yeah, I mean, I think certainly our students are going to be limited to campus when they first arrive. I don't think we mentioned this earlier, but good for you to know that dining is going to be delivering to their rooms through the 25th, and that's to get everybody through the room quarantine. And then they're going to be doing takeout pickup from the dining halls through day 7. After day 7, we expect that dining halls will open for students with some seating inside. The Vermont requirements are very strict with distancing. And so those spaces will be for students only. If you're going to be eating with students at some point during the semester, strongly encourage that it's outdoors as the weather gets nicer. So when you're thinking about that, that might be something to think about later in the semester. As Lori mentioned, there's going to be a lot of new outdoor spaces. I know the first few weeks are obviously, or maybe the first month or so is going to still feel very much like winter, but there will be some great spaces. I just really encourage you to think about face coverings, distancing, and then as the semester goes, we'll keep an eye on health conditions and promote as much outdoor activity as possible.
Thanks, Jen. There was a question about KN95s and will we be purchasing them? There are 2 vendors approved through the Department of Health for KN95 purchases. We're not planning to purchase any at this time because cloth face coverings and the masks that we are getting meet the CDC standard. So I guess I'll leave it at that. Jen, this is a question. How is the college doing with manpower with students returning? Is there a need for volunteers? And if where, how can they sign up?
Oh, that's so great. Thank you so much for that question. We do have, I guess there's a lot of needs, but we are going to be running the testing center on Mondays and Thursdays. If anybody has an ability to, it's hard to just go there for a few hours and that's it. If you can dedicate, a day or even half a day, we will be running Mondays and Thursdays. And those positions we've been running that for a while. We have mitigation measures in place. Those are safe positions, and we're definitely would look for help. And if you are interested, there are some other ways that you might be able to get involved. And we have an email, covidops@middlebury.edu, and also working directly with your supervisor and manager to talk through some of those things is the right approach. Laura might want to add a few things.
I just wanted to jump in. In essence, I am so excited for this question. In essence, it is volunteering your time to the effort. But I do want to be clear that this doesn't mean above and beyond what folks are doing, that by working with your supervisor, our goal is to reallocate and replace your work. So it's not extra work on top of everything that everyone is doing. So just a little plug there, but we'll all work around that.
Thanks, Laura. Thanks, Jen. Let's see, I lost my spot. The Wisconsin study, there's reference to that, and if it seems to be safe, why isn't there more in-person classes for students who really need to interact with others? I think that's a great question. Part of it has to do with the Vermont rules right now. We can't fit enough students into some of the classrooms for that to happen. And so some of it just has to be remote. We hope, and we've started conversations with the Restart Committee and the Department of Health to look at the Wisconsin study, look at the masking study, and start thinking about what will that mean in terms of reopening. I don't think there's time right now to get that through, but I'm hoping by the fall we'll all feel more confident. And that would also mean the vaccines work, and hopefully the variants, we have to see what the impact of those are. So I would say, the other thing I would say is, I think the classes are set, and I think our faculty do a great job preparing for how they're going to teach, either in person or remote, and to quickly pivot, I think would be too much of an ask. But even if they wanted to, it would be hard to do because of space issues, because of the Vermont rules. So I think everyone's doing just a great job doing the best they can to give our students what they need. I do agree, though, that if we can get to more in-person teaching, I know there's some faculty members that want to do that as well. I think we'd all like to get back to normal. So a good question. Is the original health pledge, we agreed to get the COVID vaccine when available. Will there be a requirement? I don't think that's been determined yet. We're still looking at the studies on that and availability. So I would say I don't think that's been determined. There's a question about the viral probe N1-2 regarding inconclusive tests, same as a swab on the sample, or is it some aspect of the testing? That's an aspect in the lab. It has nothing to do with the actual swab, one swab or two swabs. It's actually a chemical probe that they use to test the sample. They put some liquid in the tube where the swab is. The swab is then discarded, and then they're putting in their chemical probes to look for to actually look for the viral material. Jen, do you want to talk about the Friday Middlebury updates? There was
Mark, why don't you read that to me, just because I'm trying to answer some in the Q&A.
The Friday Middlebury updates regarding spring term, read as though faculty and staff should take the Safe Colleges training program again. Is that the case? And if so,
yes.
the Safe Colleges didn't allow me to sign in with my email address.
Yes. Yep. So just so everyone knows, even if you took it way back in the spring or in the summer before coming to fall, we really do want you to go through the training again. It's a spring update. It does have all the information about the CDC Mask Guidance. So everyone should just make time to take that. And you can go to the Spring Campus Guide, Section 4, Working Safely on Campus, and you'll find a link to Safe Colleges there. You can also use go.middlebury.edu/safe colleges and enter your Middlebury email. And you should have that training assigned to you, Health Pledge and the training.
Thanks, Jen. There was a question about restaurant delivery and will Shannon Street be the location? Once students are out of room quarantine, restaurant delivery will be possible at the Shannon Street location. I'd encourage people to look at the campus status page that Jen mentioned because things will change, and that's where the changes are going to pop up first. But yes, the answer to that question is we're Shannon Street deliveries once we get into campus quarantine.
And Mark, there's also a second spot that's been added as a delivery hub on campus. It's right by Robert A. Jones in the parking lot near the Proctor tennis courts. And the cemetery, those of you that are familiar with that spot. So great question.
There's a couple things. Thanks, Jen. There's a couple of questions about, I'm flying because I'm trying to get through them to get everyone's questions answered. There's questions about the UK variant and the Burlington wastewater. It was found in the wastewater. However, when they looked at the people that in that time frame that had tested positive for COVID, they did not find any positive cases on those individual swabs as of yet. And then is it possible that the virus is mutating out of the host in the wastewater? I find that would be highly unlikely. And what we know from viral transmission studies is that if there isn't viral transmission, it's really hard for mutations to pass into individuals. So that's why the Department of Health and the CDC, as well as us, are recommending all these mitigation measures. Let's slow the transmission down, give time for vaccines to be deployed. If we can slow transmission, the mutations won't have anywhere to go, and they won't be able to spread. Can the college provide guidance on where to obtain better masks? I think what I would say is there's lots of good options, and there's all kinds of price points that are effective. And those disposable masks, if they're 2 or 3 ply, work really well as long as they're well fitting. And there are some cloth-based coverings that will work really well on their own, and there's some that will work well with a disposable mask. So it's hard to really endorse one product or another. We'll think about that, and if we find something, we can share it through staff council and faculty council. Finally, KN95 should not be double masked. What about KN94s, Jen? Should we double mask those?
Yeah, my thought is, I'll tell you, I'm not going to say I'm 100% right on this, but the KF94s or KN94s are definitely also like a filtering face piece. And so the reason why they don't recommend that you double mask a KN95 or an N95 is that they are already providing so much filtration that they can be a little more difficult to breathe through, and they don't want you to restrict that. So I would say the CDC website might have information on that. I'll definitely look that up, but my gut is telling me that those are also filtering face pieces, and you might not tolerate it well or need to double mask with those. The key, and the CDC info is so clear, just a really good fit, make sure you don't have gaps, and multiple layers is really their message. So those people that are just not quite sure, I would try different things. The CDC page even says, which I think this is funny and true, is try it at home. Don't put on some new mask combination and then go out into the world, because you might have issues with seeing or fogging glasses, or it might be itchy. So you definitely need to try and put on a medical mask and a cloth face covering over it. That's the simplest way if you're really struggling with finding something.
Okay, last 2 questions. If a person has received the vaccine, does it have to be reported on campus? If it does have to be reported, who do we report that to? It's an excellent question. We discussed it at COVID Ops briefly. I think once we get through the arrival phase, we'll operationalize that, because I think it may be important. I'd encourage everyone to hang on to their vaccine. If you receive vaccine, hang on to the little card they give you, make a copy of it, get it to your healthcare provider, get it into your medical record in case you ever need it for a Middlebury College function or something else. And then finally, will students be able to travel off campus inside Addison County at some point for class activities or other things? We hope so. It's going to depend on the local prevalence and the campus prevalence. Certainly, we could move towards that more quickly if we have a good arrival testing results. If we're similar to what we experienced in the fall, and the county prevalence remains what it is, sort of trending downward, we could allow that sooner. We want to allow that, but we're going to watch the situation carefully. And I think that's all the time we have. We've gone over. Tim, I'll turn it over to you, and just want to thank you for the opportunity.
Yeah, thank you, Jen, Mark. Thank you, Laura. Thank you, Joe and ITS, for making sure I don't mess this up. And we hope to do this again next month, right? At some point. I'm not going to hold you to it because I bet the first month of students you may be real busy, but let's try and do this real soon. We will post this recording on the staff council blog. You will also see a form as you log off on Zoom if there's more topics that you would like to see us address. Thank you all. Stay safe, stay healthy, and go have fun in the snow.